What are sinus headaches? Sinuses are cavities in the head when they become inflamed. This can lead to a sinus headache. The maxillary sinuses are behind the cheeks. They are the largest sinuses in the head. The frontal sinuses are behind the forehead. There are also small sinuses between the eyes called the ethmoid sinuses and behind the nose called the sphenoid sinuses. It's unclear why people have sinuses. It is believed that they can help make the air we breathe more humid. They are usually empty except for small amounts of mucus and lined with mucosal tissue. Sometimes sinus problems can occur, causing sinus headaches. Sinus headaches are caused by inflammation in the sinus. Often this is caused by an allergic reaction. When the sinuses become inflamed, they cannot drain properly, causing pressure and pain. The pressure in your sinuses can feel like a headache. In addition to migraines or other headaches, sinus headaches are common. They can also be triggered by an infection in the sinuses caused by bacteria or viruses. However, the vast majority of sinus headaches are not caused by an infection. The most common sinus headache symptom is a feeling of pain and pressure around the sinus area in the forehead, nose, and cheeks. The discomfort usually gets worse when the person bends forward or lies down. A stuffy nose is also a common symptom of sinus headaches. There may be pain in the upper teeth, which can be mistaken for a dental problem. If a sinus headache is caused by a sinus infection, sinusitis, the headache may be accompanied by green or yellow nasal mucus. The person may feel very uncomfortable with a fever. And, sinus infections can cause bad breath. Anyone can develop sinus headaches, including children. However, a person is more likely to develop sinus headaches if they have had a history of headaches and migraines. A family history of these related medical conditions also puts a person at higher risk. Hormonal factors known to trigger other types of headache can also trigger sinus headaches. Hence, women going through periods of hormonal changes are at higher risk. This includes pregnant and menstruating women, as well as women going through menopause. Sinus headaches can be difficult to diagnose as they share symptoms with other types of headache. A doctor begins by examining the patient and taking the medical history. They will ask about symptoms and look for any obvious signs of infection, such as abnormal mucus. You may also order medical imaging tests to determine the cause of the headache. CT scans can be used to take pictures of the inside of the head and sinuses to check for inflammation. MRI scans can also be used to check that a problem in the brain is not causing the headache. Sinus headaches are treated differently depending on the underlying cause. Pain and discomfort can usually be managed with over-the-counter pain relievers. If the sinus inflammation is caused by an allergic reaction, the doctor may recommend antihistamines or nasal sprays. If the headache is caused by a sinus infection, antibiotics can be used to treat it if the person is very uncomfortable and if the infection is believed to be bacterial. However, most cases of sinus infection are viral. Antibiotics are ineffective in treating sinus infections. However, these viruses usually clear up on their own within a few weeks. If a sinus headache is mild, it can often be treated at home without seeing a doctor. A doctor may recommend self-care measures in addition to the prescribed treatment. People with sinus headaches should get plenty of rest and hydration. Flushing the nasal passages with a salt water solution can also help remove allergens and irritants from the nasal passages and relieve congestion and inflammation. Saltwater nasal rinses can be bought over the counter at a pharmacy. Alternatively, the person may prefer to flush their sinuses at home using a simple device called a neti pot. This is similar to a small watering can. The person pours the salt water solution into one nostril above a sink and drains it on the other side. Many people do not seek help with mild or very occasional cases of sinus headache. However, it is important to see a doctor if the person has a very frequent headache and is taking pain medication very often. Severe headaches also require a doctor's evaluation, especially if over-the-counter pain relievers are ineffective. If the headache is preventing the person from going to school, work, or interrupting their daily life, they should see a doctor. These types of headaches need to be assessed as they can be a sign that the person has chronic sinus inflammation. It is also necessary to rule out more serious possible causes for the headache. Many sinus headaches cannot be prevented. However, they can be preventable if they are caused by allergies. Avoiding allergy triggers like certain foods or chemicals can help prevent sinus headaches from occurring. Quitting smoking and avoiding secondhand tobacco smoke can also be helpful. If the cause is hormonal, avoiding medications that contain estrogen can help reduce the severity or frequency of sinus headaches. Many birth control pills and hormone replacement therapies for women going through menopause contain estrogen.